It's so vitally important for us to understand this history if we were going to answer that question, why is modern medicine so drug intensive? And it's not because patent petrochemical medicine is superior. It's because of monopoly medicine, which was created over 100 years ago.
The doctor is brainwashed when he gets out of medical school because the medical school has too much subsidization of the professors who are being paid by the drug company. So the professor never teaches any student in medical school, why don't you try vitamin C? They're going to tell them the latest drug.
So technically you are shrinking the tumor size, but you're enriching the population of the tumorigenic cells at the very same moment. So again, the idea that some people are resistant to chemo and radiation is really a false concept. Everyone exposed to radiation and chemo will have secondary adverse effects, some of which are worse than the original condition they're being treated for.
Everyone will have secondary adverse effects from chemo and radiation. Despite this fact, as we've already learned, many doctors from countries across the globe might even lose their license if they do not prescribe chemo and radiation.
Chemotherapy destroys your army, it destroys your immune system. Not only that, it causes secondary cancers in the body, it makes existing cancer stem cells more aggressive, and it causes a host of lifelong, potentially lifelong damages to the body, from brain damage to hearing loss to neuropathy with loss of the use of your hands and feet to kidney and bladder damage, bone damage, heart damage, lung damage. It's just total collateral damage.
It is a deception. It is an unethical, deceptive business that creates illusions for millions of people, and every scientist involved in it. I'm not blaming the doctors. They sometimes don't have the education to go at that length. But every scientist knows that it is a huge fraud.
And the FDA, on its own website, openly admits that 100,000 plus people die each and every year from properly prescribed prescription drugs. What does this mean, the term properly prescribed prescription drugs? This means, according to John Rappaport, these are drugs that were previously declared to be safe and effective. But what does it mean to be declared safe and effective? What is the drug approval process that would declare a drug safe and effective?
The real interesting thing, Ty, is that what they do is drug companies pour literally $1 billion into the research needed to get FDA drug approval. So that starts with finding lead compounds to produce a synthetic chemical that then they go through phase 1, 2, 3 human trials with. But when they do this, they pour inadvertently $1 billion or more, all of these drug companies, into looking at turmeric, resveratrol, green tea, and literally thousands of compounds, and they find all this research showing it's superior to chemotherapy. And so those studies are there, and people don't know about them, but they also can't expect those studies on things you grow in your backyard that cure cancer to receive $1 billion of capital, because the whole game is based on producing a synthetic analog to get a patent, to get FDA drug approval. And then, of course, more than 50% of FDA-approved drugs before the patent life expires get pulled off the market because of the devastation and death that they cause. So the whole system is rigged.
I would have to agree with Sayer G. The system is rigged.
This is a total war. Texas Medical Board is going after my doctors, is going after my assistants. They are suing everybody because of using the treatment which is non-conventional.
If you do the standard of care and you give chemo and people die, it's okay. If you don't do the standard of care and people live, that's not okay. It's politically incorrect. So this is the amazing thing. You take a poison, you give it to people, they die. It's part and parcel of the normal status quo, modus operandi. This is how it's supposed to be. Now you break that, you actually do something that's not toxic, you help patients, they live. Hey, we don't care whether the patient lives or not. That's irrelevant. It's not part of the standard of care.
Harry Hoxsey is another example of a man who was treating and curing cancer naturally that was heavily persecuted. Now, this is a story that is near and dear to my heart because in 1996, when my father, Graham Bollinger, was diagnosed with stomach cancer, we were doing everything that we possibly could to take him to what's called the Hoxsey Clinic in Tijuana, Mexico. Unfortunately, Dad died before we could get him to the Hoxsey Clinic, which is now called the Biomedical Center. And the AMA wanted to buy out the Hoxsey formula. They almost signed the paperwork, but
they got to the point of signing the papers, and he said, you have to make this available to everybody. And they said, we may not make it available to anybody. We may not use it even. And he said, no, that I won't sell it.
So they basically wanted to buy it and bury it.
Bury it, yes.
And basically what everything spins around, it's what is known as the Hoxie formula. It's a liquid made with a combination of several herbs and minerals, and it, because of the way that it's put together, it selectively targets only the malignant cells. Any cell with a bad DNA or a bad metabolism, those are the ones that are going to be destroyed. Okay. Of course, there's a few vitamins, there's a diet, which is not a difficult one to follow. And we also use a lot of herbal, both Occidental and Chinese herbal formulas.
The formula that you're using, is this pretty much the same formula that Harry Hoxie used?
Exactly the same.
80, 100 years ago?
Exactly the same. It was passed down from Hoxie over to Mildred, and then Mildred brought it into the clinic, and then she passed it on to Liz, she's the owner now, she's Mildred's sister, and we still use basically exactly the same formula as it was being used in Texas.
So if somebody comes into the Hoxie clinic here and they want treatment, how long does the treatment typically last?
This is a clinic that does something in a different way that most of the regular clinics. We try to do everything on a single day. People come in the morning, they get registered, they go through the laboratory, they go through the x-rays, they get their consultation, a very thorough physical examination, and then we have to wait until we get the reports from laboratory x-rays, which takes a couple of hours, and then we call people up for a second visit in the afternoon, and we explain all the findings to them. We give them their treatments, and they just pick up their supplies and make their payments and go home, same day. Wow. This is something you can do at home. You don't have to be necessarily hospitalized to do it, you know? And they stay on the diet, and they come back for a checkup every 6 months, every year. Eventually, just come back every 2-3 years.
Okay. Being a one-day treatment, the Hoxie treatment, relatively affordable?
I think so. I think we're the cheapest clinic in town.
Are you really?
Oh, yeah.
They can allow progress in this and that diseases to kind of mask their principal business, but they cannot allow cancer to disappear or being identified as a disease that can be regulated or prevented. So long ago, they have initiated what Dr. Netswicki mentioned, the factor fear. In fact, it's more than that. It's a psychological warfare on humanity that the pharmaceutical industry is leading with the tool cancer. Keeping cancer as a death verdict is the platform, is a precondition for this entire investment industry to continue.
You do not have to live in fear. You can prevent and beat cancer